I'd like to start first with a viewer question from Rosie. Let's see what she has to write and discuss her question to you. She writes, my two sisters died of breast cancer. One was in her 30s and the other in her 50s. I am also in my 50s and have biopsies every 6 months. I have been tested and do not have the BRCA gene. My question is, will I get breast cancer? My mother had it in her 30s and had a mastectomy and is 83 and never had another problem. What are my odds of getting this terrible disease? First of all, Rosie, we're so sorry for your loss. You've been through so much. Doctor, what thoughts do you have for Rosie?
Rosie brings up a situation and a question I think that is very common and unfortunately rings true for a large number of women in our society. Breast cancer is the most common is the most common kind of cancer in women. Approximately 1 in 8 women will experience a breast cancer diagnosis within their lifetime. And over 280,000 women in the US alone are estimated to be diagnosed with breast cancer in 2021. So we've all had a loved one, a mother, sister, aunt, somebody that's been touched by breast cancer. So to Rosie, I would say that given her situation and her family history, she is doing, I think, a great job of trying to stay vigilant and keeping up with her follow-up and surveillance. But it's not clear necessarily that she has an identifiable genetic risk factor that we can identify on testing. So we would estimate that, in essence, she has a 1 in 8 chance on average of getting a breast cancer. Due to some of her family history, that may be slightly higher, but it's by no means a preordained or predestined fate that she will be diagnosed with breast cancer. Many women, even with these family histories, still go on to not develop breast cancer in their lifetimes. And I think what she's doing is excellent, and she should continue her surveillance and her close follow-up with her doctors to make sure she has the best outcome possible.
Which is the best thing she's doing, absolutely, keeping track of how she's doing and following up with her doctor as well. Doctor, thank you so much. We have another question from Suzanne. Let's take this one. And she's asking the following. Are there advances in the treatment of triple negative ductal carcinoma? So doctor, if you can explain for our viewers what that is and then answer her question. And thank you so much, Suzanne, for that question to the doctor.
Yes, thank you, Suzanne. So this subtype of breast cancer that Suzanne's referring to, known as triple negative ductal cancer, is one of the 3 main subtypes of breast cancer that we as physicians encounter in our practice. And triple negative refers to the fact that when we diagnose a woman with breast cancer, we do testing in order to figure out what makes the cancer tick. What are some of the medications that may or may not be effective in treating their breast cancer? And so we check 3 proteins on the surface of the cancer cells. One of them is known as the estrogen receptor. Second one is known as progesterone receptor. These receptors, like the female hormones, estrogen and progesterone, which are produced in a woman's body and helps encourage them to grow. The third receptor is a protein called HER2. And that is a growth factor when it's overexpressed in certain breast cancers, encourages its growth and spread. And so when we test a tumor and it's negative for all 3 of those proteins, we call it triple negative breast cancer, which means that these tumors do not respond to anti-estrogen therapies like the hormone receptor positive group, nor do they respond well to anti-HER2 therapies that are available for that subtype that overexpresses HER2. And the predominant method of treating these breast cancers is through chemotherapy. However, there have been some major advances in the treatment of triple negative breast cancer that have improved outcomes recently and are quite exciting. One of them is the use of immunotherapy. So many of you may have been aware that there are drugs that have been FDA approved for a number of different cancers, such as melanoma, lung cancer, and others that utilize drugs that stimulate the host's or the person's immune system to help them fight the cancer off and control it with much higher rates of success. Triple negative breast cancer is one of those types of cancer that do have FDA approved immunotherapy choices for treatment of women with either metastatic or, we hope in the near future, early stage non-metastatic triple negative breast cancer. And that's an exciting advance that we hope we can continue to improve on in the years to come. Second, there's been some recent approvals of targeted drugs, which utilize a specific targeted way to deliver chemotherapy agents that are too powerful to give intravenously by themselves, but rather we link them to special proteins called antibodies. And what this does is creates a type of smart bomb or smart missile that can lock onto the cancer cells and deliver the chemotherapy payload specifically to the cancer cells while sparing a woman's normal tissues, thereby reducing the severity of the side effects that she experiences. And these drugs have shown tremendous activity in women with triple negative breast cancer and recently have been approved by the FDA. One of them is called sacituzumab. And so we are making some major progress and strides in treating triple negative breast cancer using these novel drugs. And this is just the tip of the iceberg. There's much more to come.
We've come a long way, like you said, doctor. Many, many years ago, it was taboo to even talk about this. And now it's an open discussion, rightfully so, to help women know that you are not alone. True, doctor?
100% agree with you, Olga. I think the hope that we all share that science, technology, new treatments are able to potentially cure many more women with this terrible affliction than was possible in the past gives us all a reason to be happy and hopeful that we can not only survive a diagnosis like this, but thrive through a diagnosis like this. But it's also important to focus on the human aspect as well. And through awareness, connections with others, and support, it can also provide that spiritual support that many patients need as they're going through a tough diagnosis like this to help them get through these times. So I think it's amazing that we hear from survivors and people that can really provide that ray of hope and guidance for many of our patients in these times.
Doctor, I mentioned when we started this show that you are the medical director of clinical trials at Moffitt Cancer Center. How important are these clinical trials?
Olga, I cannot emphasize enough how critical, I mean, the absolute need for our patients to be aware of clinical trials, to ask their doctors about clinical trials, and to participate in clinical trials is paramount to our ability to succeed at providing cutting edge and new treatments for patients with cancer. All of these treatments that I just mentioned to you in the prior question that Suzanne was asking about regarding developments in triple negative breast cancer would not have been possible without successful clinical trials to show and demonstrate that they're effective and safe to use as a treatment option. All of our therapies that we recommend for our patients in clinic had to go through clinical trials in order to secure an approval by the FDA. So we desperately need patients, advocates, everybody who's involved in the breast cancer space to get the message and the word out that participation in clinical trials is crucial. It's critical for us to continue to improve outcomes for women with breast cancer.